Hey guys, Dr. Childs here. Today we're going to be talking about Pure D3 Liquid, which is my vitamin D3 supplement. Okay, we're going to be talking about what type of people should be what type of people should consider using it, why it's beneficial, the dosing, what you should look for, and so on. So we're going to get into all of that today. So the first thing I want to talk about is this vitamin D3 liquid, which is just in the basic sense is just a D3 liquid, which is in a micellized matrix, which means it enhances the absorption. So this is, in my opinion, the best way to get vitamin D3 into your body is in this micellized matrix because it enhances absorption. Of course, vitamin D is a fat-soluble vitamin, which means sometimes those fat-soluble vitamins can be a little difficult to absorb, which is why we give it a little boost by putting it in this matrix. Okay, but why would you want to use vitamin D3? Why would you want to use this sort of supplement, or any D3 supplement, frankly, for that matter? And the reason is pretty simple. Vitamin D3 deficiency is rampant in our world. And when I say rampant, that is an understatement. Okay, there's something, last I looked at the literature, there was something like 2 billion people, yeah, billion with a B, people who are deficient in vitamin D3 in the world. That's something like almost 1/3 of the world's population are D3 deficient. And that actually isn't a funny thing because the importance of D3 in your body. So I've included a little bit of a list of symptoms here that I want to talk to you guys about. And these are things which D3 can potentially help as long as you are getting enough of the D3, and we'll talk about the dosing in just a minute. One of those symptoms would be fatigue. So a lot of people who are D3 deficient have low energy levels. Another one is depression. So we know that this is called seasonal affective disorder for a reason. And what happens is in the winter months, you don't get as much sunlight because of the way that the sun is reflecting off of the earth because of the position that it is in relative to you on the earth. And what that results in is reduced vitamin D in a lot of people. And certain people are just really sensitive to this. They get a lot of depression, okay? And this happens in a lot of places, especially if your latitude is really high up there in terms of its where you fit on the globe. So this happens more frequently in those with higher latitudes. Another thing which is really important would be if you have low levels of vitamin D3, you're going to have a much higher risk of developing autoimmune disease of any type. But of course, if you're reading my blog, we talk a lot about Hashimoto's thyroiditis because I focus a lot on helping people with the thyroid problem. But vitamin D3 deficiency, guess what? Can increase your risk of all autoimmune, of developing any of these autoimmune diseases, which is obviously particularly bad and not something you want to have happen. Another thing is that people with low levels of D3, they have a weakened immune system. So that just means a weakened immune system in general. Now, I mentioned before that obviously these people can get, they have an increased risk of autoimmune disease, but a weakened immune system also increases your risk of developing all sorts of colds. So if you have these type of colds and you're just getting them all the time, or you get every bug that you come into contact with, guess what? Vitamin D might be part of it, and taking vitamin D might help bolster your immune system and help you with that problem. Another thing would be bone loss and hair loss. Those are things which are, can potentially happen with low D levels, and then of course muscle pain as well. So those are the reasons, or those are the symptoms associated with vitamin D3 deficiency and why and how you might potentially benefit from using D3. So let's talk a little bit about who should use it though, because a lot of people are confused. Well, they hear a lot of this, oh, that sounds really good, but should I use it? And the answer is, for some of these supplements is, in my opinion, I think a lot of people should be on them. In fact, I have a list of supplements that I put, if you don't know what to put yourself on, there are 5 things that you can do, which are just the most likely to cause or to have a benefit in your body, because so many people are deficient in certain issues and certain vitamins and certain nutrients. And in my opinion, D is one of those, okay? I already said before that something like 2 billion people are deficient in vitamin D3. And that means that even if you don't test yourself, if you're not getting enough sun, and by sun I mean sun exposure with 40% of your body uncovered each and every day, or again, the chances of that happening is very slim, although some people do. If you fit into that category, then you're probably going to want to use vitamin D3. Now, I love the liquid because it's so easy to take. You can just pop it under your tongue, take it sublingually, or just put it in your mouth. It doesn't really have a bad taste, and you can take it really easily. The other good thing is that you can just give it to your kids, right? And so it's really easy to give your kids a liquid as opposed to a capsule or a pill because they have to swallow those things. Okay, so going back to that main question that I was asking is who should be using it? In my opinion, almost everybody. Certainly everybody who has vitamin D3 deficiency. Do you need to check before you use it? that's up to you. I feel comfortable not checking my levels all the time, and I supplement with it. I give it to my family members. But if you're somebody who wants to know what your D3 level is prior to supplementation, feel free to do that. But I think this is one of those standard sort of things that a lot of people are deficient in, and it can benefit a lot of people. So in my opinion, most people should be on it. Another group would be obviously those with known vitamin D3 deficiency. So these are people who have gone into their doctor, they've had their vitamin D3 tested, that it's shown, or not D3, but D level is tested. You supplement with D3, you check your vitamin D in the blood. But if you have a known low level of vitamin D, take vitamin D3. Not D2, by the way. Your doctor will try and give you vitamin D2. You do not want that. You want only D3, which is cholecalciferol, just FYI. Okay, so the other group of people that I would mention here would be anyone with thyroid problems, especially those people who have Hashimoto's thyroiditis or any sort of autoimmune disease. You really want to get your vitamin D3 level up if you have those conditions, and even a little bit higher than probably you would otherwise normally, because they can help impact your immune system and may help treat your autoimmune disease. Anyone with depression or fatigue, those symptoms we talked about previously. So let's talk a little bit about dosing. The reason I like this is because it's really simple to dose. It doesn't require any math. It's 1 drop is equal to 1,000 IUs. That's it. It's pretty simple, right? And in each bottle, there's 1,500 servings. So there's basically 1,500 drops in each of these things. And I did the math for you just to give you an idea. So if you did 5 drops per day, which is 5,000 IUs, that's enough for 300 days. Okay, so this is going to last forever, basically. And what I do is, if you're using it for one person. Now, what I'd recommend that you do is you use it for yourself, get it for your family. It's really simple to provide to people because it isn't a liquid. You can just, drop. Little kids need a smaller dose, so usually about 1,000 to 2,000 IUs. Now, I really don't like it when adults even go beyond 2,000 IUs. And the reason for that is because I think that you should be trying to get your vitamin D3 level up the natural way through sunlight. But I know that that's difficult, and like I said before, it actually may be impossible if you live at those higher latitudes. So you do need a supplement. But if you really wanted to push your numbers up, fine. Take 5,000 to 10,000 IUs per day for a couple weeks, and you will see that vitamin D level go up. I have no doubt about that. But my recommendation is sort of like a baseline dose is somewhere between 1,000 and 2,000 IUs. I take about 2,000 IUs, and I make a point to go out into the sun each and every day with 40% of my skin exposed. But like I said, it's not always possible for my wife. It's not always possible for my kids, so I do use this. So again, if you get this, it should last many, many months, and it's in my opinion, it's one of the most highly absorbable formulations of D3 because it comes in that micellized matrix. So that's pretty much it about vitamin D3. While it is a relatively simple supplement to explain, it's a very important and a very critical supplement. In fact, a lot of people refer to vitamin D3 more as a hormone than it is a vitamin, simply because of its impact in your body and the impact it has on all of your cells. And I tend to think that that's a little bit more true of a statement in terms of how it functions in the body. So don't neglect it, even though it might not seem fancy. It doesn't have a lot of pizzazz or whatever compared to weight loss supplements or thyroid boosting supplements. But this is an incredibly important supplement that you should be taking every day. If you have questions about whether or not it's right for you for whatever reason, reach out to us. You can respond via email or leave your question in the comments below. We will get back to you. We want to help you. If we don't think it will work for you, we'll let you know. Or if you have some sort of different condition or whatever, and you're not worried if it'll work for you, let us know. The base of this, by the way, is sunflower oil, which is perfectly safe and fine and healthy. So you don't need to worry about the base. There's no other added things into it. It's just vitamin D3 and sunflower oil. So that's it. If you have any questions, let me know. Leave them in the comments, and we'll get back to you as soon as we can. And otherwise, I'll see you guys in the next one.